Welcome to NDF's 2021 Virtual Speaker Series, generously sponsored by the Rotary Club of Beverly Hills. I'm Nancy Lurie, NDF's Chief Operating Officer, and I'm so glad to welcome you here with us this morning. Today's presentation is one that I've been especially looking forward to because it's a topic that feels relevant to anyone and everyone, especially right now. We're so grateful to be joined today by Dr. Jennifer Yashari and Carol Gelbard. As some of you may know from her fantastic blog post, Jen Yashari is a psychiatrist who, in addition to having a private practice, has been a volunteer clinical faculty member at UCLA and serves on the health advisory committee for the Ladies' Home Journal magazine. As a GNE myopathy patient herself, Jen brings a uniquely qualified perspective to events such as today's. Carol Gelbard has more than 15 years of experience as a licensed clinical social worker and has been part of NDF's efforts for many years. First as a board member and now as NDF's own emotional wellness director, Carol has led patient caregiver groups at NDF symposia, facilitated patient huddles, and now works collaboratively with the NDF team to develop programs and help patients develop supportive care plans to address their overall well-being. Before I turn it over to Carol and Jen, I just want to mention that you should feel free to add questions in the Q&A throughout the discussion as you think of them. Questions in the Q&A will only be seen by our presenters, and Carol and Jen will address them once they're through with their presentation. If you have comments to make to the entire group of people joining us today, please use the chat function. And with that, I'll hand it over to you, Carol and Jen.
Well, it's such a pleasure. First of all, Nancy, thank you for that lovely introduction. It's such an honor to be here today with Dr. Jen Yashari, talking about a topic that we think is incredibly important. And this topic was brought to us, I don't know, a couple months ago, and I thought, sure, we'll do reentry and we can talk about anxiety, and that should go pretty well. And then obviously things have changed pretty much in the last couple of months a lot, and especially in the last week. So we're going to talk a little bit about that. I mean, I just read an article yesterday in the New York Times talking about how COVID crisis is not over. So here we are again, pivoting and adjusting. And also kind of the thought process was we're going to have to learn how to live with COVID. Like this is going to be around for a little bit. And especially with the variants, depending on what part of the world you live in, you know, these variants are kind of a little bit of a game changer. Not so much, it seems like they're preventing from serious illness and hospitalization, but what we're seeing is the spread is still continuing. So we still have to make modifications again and adjust. So that's why this topic, I think, is so important, because we are all kind of in this maze together of trying to figure out how do we manage our anxiety as we gradually emerge from this global pandemic. I'm going to go to the next slide. So I wanted to kind of talk a little bit about what we're going to go over in this talk. The first thing we're going to do is we're going to review the findings of the American Psychological Association stress survey and talk a little bit about the mental and physical ramifications from the pandemic, what has happened to people's physical health and mental health as a result. We're going to identify stressors and challenges that is related to the GNE myopathy population. We're going to look at strategies to help people cope more effectively with reentry anxiety. And we're also going to explore ways to build resilience during the wake of the pandemic. But before we do that, I think it's really important, because both Jen and I, as mental health professionals, we are always wanting to reflect back to look at where we were and where we are now. So I'm just going to briefly talk about this timeline that came out of Yale Medicine, just to kind of review what has happened in the past 18 months. As many of you know, in January of 2020, we heard about this mysterious new illness, and we were all like, okay, this is coming out of Wuhan, China. How is this going to impact us? I don't think there was a lot of concern initially, but as you guys are well aware, come March of 2020, it seems like the world shuts down. And on March 11th, World Health Organization declared COVID-19 as a pandemic. Now, pretty quickly, at least where Jen and I live in Los Angeles, things shut down very fast. The schools closed, no more events, countries sealed their borders, no travel. And we were all like, oh my God, how are we going to do this? Locked in our house, like not seeing people, not seeing our family, and having to stay in these pods. And what's this word, social distancing, which, by the way, ended up having a lot of it was almost like it was controversial because it was kind of the wrong word. It really was supposed to mean that we were supposed to physically distance, but as we know, the ramifications were people felt more emotionally and socially distanced from each other. So it probably wasn't the best word to use in hindsight. They probably should have said physical distancing, but we hear this concept and then people kind of are like, how are we going to manage this? Whoever thought that we would be in this for as long as we are, and pretty quickly there was an uptick by the summer of people struggling, like within a few months. There was a uptick of mental health issues. There was unemployment. People were trying to balance all these roles of taking care of their kids and Zoom schooling and trying to work from home and juggling all these hats. And I know for a lot of GNE myopathy patients during this time, it was incredibly challenging. And then we got some good news, in the fall of 2020. We hear that these vaccines have been approved and everyone's like, oh my God, this is a game changer. This is really good. And we heard about the effectiveness. And I think we saw that there was light at the end of the tunnel. Come 2021, we get the vaccine rollout based on where you live. I understand some people that might be tuning in might not have access yet to the vaccine, but the vaccine rollout, at least in the US, started in January. And now, we are still in the rollout. Not everybody's vaccinated, but we definitely are seeing that there's some progress, but we're still pretty much in the thick of it. And I also feel it's really important that we also address, it's this daunting statistic that 4 million people died from COVID. So this is a pretty serious thing. 4 million people in the entire world is a dramatic number. So I feel like we've been through this communal tragedy of trauma, and there's a lot of grief and loss. And when Jen and I were kind of talking about it, we were like, she said, look at the parallel process. This is kind of related a little bit to what GNE myopathy patients deal with in their journey. So Jen, it would be really helpful if you kind of shed some light on what we were talking about the parallel process with this timeline and the timeline for GNE myopathy patients about their diagnosis and so forth. Ooh, Jen, I think you're muted.
Sorry. Hi. Okay. So yes, I'll speak to that, and just thank you, Nancy and NDF, for putting us together. And these speaker series are so helpful. And yes, so Carol, even just that first bolded marker, mysterious new illness, that alone, the being ambushed or shocked when a patient finally does arrive at a diagnosis, the parallels between not knowing what this is, what is it going to look like? So that anticipatory anxiety that sets in, not having a lot of experience, not knowing what people's courses will be, just like with COVID, some people mild cold, some people intubated. So when you think about anxiety being really two things, difficulty tolerating uncertainty and relinquishing control, not having control, both GNE myopathy and COVID or sort of experiences for all of us of just swimming in seas of uncertainty and anxiety and genuine threat. GNE myopathy, threat to our bodies and our physicality, COVID, threat to our lives. So in a lot of ways, I think a lot of us patients felt like kind of welcome aboard. Not that we're welcoming people in a positive way, but we have had to kind of master how to tolerate these levels of discomfort. And so I just found that to be interesting. For a lot of us, we've been living in this uncertainty for years, and other people are experiencing it for the first time.
Yeah, I think you're 100% right. The uncertainty is, everybody's feeling it, but you guys are accustomed to it given what you have to manage day in and day out. So we're going to talk a little bit about what has really happened as far as the stress. We're going to, the study I'm going to talk about is actually a study in the US. I'm sure it parallels what's happening in other countries as well. But, 1 year later, the American Psychological Association did a survey in the spring of 2021, where they surveyed 3,000 adults. I mean, it's a pretty big number. I mean, I'm sure there's going to be more studies coming out. And they were looking at the impact on the pandemic on people mentally and physically. And the concern they had was what was going to happen with this prolonged stress that we were enduring for this long, exacerbated by grief, trauma, and isolation, that there was some concerns that we were going to have this secondary crisis. Like we were dealing with one crisis and trying to put out that fire. What else is happening in the meantime? And there was some persistent, probably physical and emotional consequences that might be here for years to come. I wanted to talk about this study so we know the impact of this pandemic had on people. And I know that a lot of people that we're talking to today have other life stressors as well. So this is just compounded with what people already have on their plates. So we're going to talk a little bit about this study, what they found out, which is not going to be a surprise to many of you. Actually, before I do that, oh no, I'll get to this and then I'm going to involve Jen. Sorry about that. They noticed that 50% of people delayed or canceled healthcare appointments and services. And I know that has to be true for a lot of our patients who weren't able to go see doctors, weren't able to get routine screenings. They weren't able to take care of their health the way they are accustomed to. And over 50% of people reported they were less physically active than they wanted to be. And I know that has been true with a lot of GNE myopathy patients who have said that they really feel their progression got worse during this 18 months because they were not active. They weren't doing exercises and having people help move their bodies and so forth, that they deteriorated during this time. So it also was what was happening with the general public. They were also sharing the same concerns. And we're going to look at the trends, what they found. And this part I thought was really interesting. Won't be too much of a surprise to Jen and I because we probably see this in our practice, but they looked at mothers and fathers, and it was interesting that moms were more likely than fathers to say that their mental health worsened during the pandemic. Men did not report that, but they reported more behavioral and physical changes. So what you can see from the graph on the right, that dads reported that they were sleeping more or less than they wanted, that their sleep, 87%, that their sleep was disrupted. That's a pretty high number. 77% of moms reported that. Weight changes, as we see, dads, 80% weight changes, undesirable weight changes, I should say, could be lost weight, gained weight, 66% of moms. And then obviously, this is not a surprise either, that a lot of people began drinking alcohol and probably using other drugs to cope with stress, 48% of dads and 29% of moms. Now, to the left, this is another thing that I thought was pretty concerning. 75% of people said they could have used more emotional support than they received. That's pretty significant. 32% received treatment from a mental health professional, and 24% were diagnosed with a mental health disorder since this pandemic started. So that means 1 in 4 people basically came up with a mental health disorder that was during the time of the pandemic. So I think that when I saw this, I thought, okay, we got to recognize this, and people shouldn't feel alone. This is the impact that this trauma or this pandemic has had on people. Jen, can you talk a little bit about like what you've seen in your practice? What are some of the trends you've seen during the pandemic?
Sure, yes. So again, I mean, this has been traumatic, just the nature of this unexpectedness and without a whole lot of preparation for most, and not knowing where it's going. Initially thinking it's going to be a few weeks, so maybe there's a bit almost of like a novelty to it. People planting gardens and doing puzzles and picking up painting, and those, we're adapting, and then it starts to be prolonged. And then there's a kind of mental fatigue that sets in. And as you said, the stressors of childcare, of work, of quickly having to adapt. And so in terms of mood, people being isolated, especially for people who recharge their batteries by socially interacting, by being in their communities. People didn't have, and still don't do to their usual coping mechanisms, whether it's a healthy or unhealthy one, being out, being traveling, going to movies. Those are ways to distract from the emotional discomfort that lives inside. And so when those are no longer available and there's more quiet in there, there's more room for anxieties and fears and sadness to show up. People engaging, as you've said, drinking, drugging, eating. So a lot of that, whereas pre-pandemic, people can kind of get by and you rely on certain coping mechanisms to avoid them showing up into an office like mine. this really was a game changer for a lot of people, realizing it's not sustainable and they needed to find healthier ways of coping and adapting.
Right.
And health.
Thank you for sharing them.
Of course, sure.
I didn't mean, there's a little delay. Did you want to say something
No,
else?
just even just health anxiety. I have a sniffle, I have a cough, there's just so much more that can be overanalyzed when you're in a state of sort of hypervigilance at all times.
Got it. Thank you for sharing that. That's very true. We are seeing a lot of shifts within people. And as you said, like the self-soothing, I think is what people are doing to soothe themselves. They're going to unhealthy ways before they might have had more adaptive ways. So let's talk a little bit about what we've seen within the GNE myopathy population. And by no means is this a comprehensive list. These are just some of the things that got brought to our attention. Please feel free to use the chat if you want to include any other stressors that you have experienced, and we can obviously address those as well. But these are some of the things that we have heard that GNE myopathy patients are saying. These are some of the stressors: that they had less access to doctors, care providers, specialists to help them manage the disease. A lot of people rely on people coming into their home, and that was a big shift, that they couldn't have their physical therapist come, their
nannies,
caregivers come in, that there was really a lack of access to specialists that were able to help them. Less active, which accelerated the progression of the disease. Increased isolation for many patients. Less opportunities for travel for patients with declining mobility, asking themselves, can I do this type of trip in a year or two? What's going to happen? Can I manage it? Increased burden for caregiving placed on family members. And there was an increase in injuries for a lot of patients, we have heard, during this 18 months. Concerns of needing help from strangers when they go back into public. Are people going to help? Are people going to be less inclined to help now because we've had this pandemic with people wearing masks? And many patients really rely on the good nature of others to help them when they're out in the community and out in public. And the other thing that came up is return to places that might be challenging due to changes in one's physical functioning. So Jen, when you're looking at this list, what are your thoughts, and what do you relate to, and what do you want to add?
Right. So I, of course, can only speak personally to me, but a couple on there that really resonate with my experience. With injuries, you always think of injuries they often do come from tripping and falling and doing too much. But my experience wasn't as a psychiatrist. When I'm at work and in the office every day, I'm getting up between patients, I'm walking down the hall to the bathroom. When everything shut down and my office became a corner of a room, I wasn't getting up, because as patients, we preserve our physical energy as much as possible. So if I can sit all day, I will. And I ended up having some really unfortunate sort of body issues and pain issues because I was sitting so much. And for some people, for people who don't have physical disabilities, they're not working out, they're not keeping up with their physical therapy. It's reversible. They can get back to it. For us, it's a one-way street. So for me, no physical therapy, no massages initially, not moving around as much, no gym equipment at home. I had to scramble. That creates a tremendous amount of anxiety. And there are, again, ramifications, this whole reverberation in my head always of like, use it or lose it, use it or lose it. It puts a lot of pressure on. And for me personally, the loss of travel opportunities. I had a trip planned to Italy, which again is a good problem to have, but planned a year in advance because of the anticipation, the excitement for certain things that required some accessibility or physicality. And then a year later, trip not happening. Another year later, still can't happen. So I'm looking at 3 years from where I was physically. I know I can't do the same trip because my acceleration has progressed. So again, unlike, we'll go again next year, no big deal. It is a big deal, and not one that's easy to advertise because it's travel and there are bigger problems and literally people are dying, but it's still a loss nonetheless. And that's something that I think is really specific to people with chronic illness or progressive diseases.
And you kind of have to honor that it is a loss. even if it feels like, I know people have it worse, but it's still a big loss of an adjustment. And all these stressors are big adjustments and losses, and allowing yourself to recognize them. I don't know, because I don't have access. Did anybody add anything else into the chat? I have my screen on, so I can't see. Jen, are you able to see?
I don't see any questions that I can see.
Okay, all right, so we can move on, and if afterwards we can add to it if we see it when we do the Q&A. And by the way, I also want to tell everybody, if something comes up while we're talking and you have like a pressing question, please put it in the Q&A, and we'll just do it when it comes up, and we'll get to it at the end of the presentation. So now that we identified the stressors, we're going to talk a little bit about reentry anxiety, but I also was recognizing it's not just about reentry anxiety, it's just about anxiety in general. And these tools that we're going to talk about is not just about reentry, it's just about managing anxiety, no matter what the issue is. Okay, so before we talk about reentry anxiety, it's important to recognize the biological function of anxiety. So I'm going to ask Jen a couple of questions as our expert psychiatrist. And I know you specialize in anxiety, so it's great that we have her today. Why do we have it? Why do we have anxiety? What's the purpose of it? Can it be productive? Can you shed some light on the function of anxiety?
Okay. So as you said, productive. So anxiety, first of all, we rely on it for survival. If we couldn't feel anxiety, we would be putting ourselves in harm's way all the time. And so we adapt from a bioevolutionary standpoint, which I always like to look just from a scientific standpoint. If something, again, like I said before, anxiety is essentially about two things: difficulty tolerating uncertainty. We like things to be very clear and black and white. We don't like when it's gray or amorphous. And difficulty relinquishing control. When you let go of control, anything can happen. And so if we look at how we were as cave people, let's say, if there was a saber-toothed tiger on the horizon and you could not identify what that was, and that was uncertain and you had no control over it, it could literally kill you. And so we've adapted what's called the sympathetic nervous system, which we know is fight, flight, or freeze, to allow us to be reactive, to be hypervigilant, to pay attention to every sound, and to do something about it. That's healthy. In modern day, we often perceive things in our environment, our surroundings, as life-threatening because maybe they're unknown, when in fact, they are simply uncomfortable. So unknown doesn't mean unsafe. Unknown means uncomfortable. We don't like it. We're designed not to like it. But when anxiety goes up, we know that kind of cognitive functioning shuts down. And so you can't think clearly when you're anxious. So what we're looking at always, and in the context of the pandemic, productive anxiety is keeping your distance, making sure people are wearing masks around you, washing your hands. Unproductive anxiety is obsessing, or what we call ruminating on, am I going to die? What's going to happen to me? Am I having a cough because of COVID? But if I'm not channeling that into maybe getting a test, now I'm just spinning out of control. And so it's really important to check in with yourself and what is a natural reaction to a threat, and what is a reaction to something just being out of control and unknown, which is less productive.
Right. Thank you for that explanation. And we're going to obviously dive deeper into that as this talk goes on. But, when I was thinking of reentry anxiety, a good way to look at it, and I'm sure this parallels also for people with GNE myopathy, is that we've all been thrown into this crazy maze. And it's complicated, it's confusing, it's overwhelming. We have all these twists and turns, and nobody knows when it's going to end. How are we going to get out? What kinds of impact it's going to have on us? And so it's this like collective experience of like all this uncertainty we're all dealing with. And as Jen said so eloquently, is our brains are really used to routine and predictability. Well, nothing about this is routine and predictable, especially probably with people managing their disease. There's nothing predictable, there's nothing routine. And also we are, living with a great deal of uncertainty. I also recognize patients deal with a lot of uncertainty. So in many ways, GNE myopathy patients are experts in dealing with the unknown and dealing with the uncertainty, not because they want to be, because they've been forced to have to be. So, it is a lot of uncertainty, but also what's happening during this pandemic. I think there's a lot of questions people have of like, we are attuned more than ever to our environmental cues, which gives us a hyper vigilance when we go out in public, that people are constantly scanning their environment, scanning for, are people too close? Is this person wearing a mask? That person bringing my food, is he or she wearing a mask? That person preparing my food, should I go into that person's house? I don't think they've been safe. You know, it's all these things that you have to constantly assess. And you know, it's a lot to process. But I also know, you know, Jen, you were also mentioning to me that like people who, you know, have mobility issues, you have to constantly survey your environment. Can I navigate that curb? Can I get to that place? You know, so this scanning your environment is not something new, but it's something that everybody's on high alert now. And this is also being compounded with all the information we are getting from our county, from our state, from our federal guidelines that changes constantly. And you can start, as you said, Jen, like people start ruminating about all this stuff. Like, oh my God, this is getting bad again. How am I going to deal with this? What's going to happen? Our school's going to close again, or, you know, or my kid's going to be stuck at home, or what am I going to do? So you could just kind of get yourself spinning about all these thoughts that occupy you. And like, what do we do with all that? So, you know, when we think of anxiety, I was actually thinking about it even today, because anxiety is part of all of us. I mean, I was a little nervous before doing this presentation today, you know, and I was like, okay, I'm a little anxious, and that's all right. So we have to look at anxiety kind of, not that it's bad or good, but it's like on a continuum. It's not like you have it or you don't, you have degrees of it. So I want people to think of their anxiety as either being really high anxiety at a 10 and down to 0 where you have no anxiety. So recognize that it's part, first of all, it's normal. It's part of survival, as Jen said, but it's also, you have to just manage it and be aware of it. So we're going to talk a little bit. Let me get to the next slide.
You just muted yourself, Carol.
Okay. Sorry, I was trying to get to the next slide and suddenly I unmuted myself, but we're here. All right. Did re-entry, sorry about that. So now that we talked about anxiety and all the stressors that people are experiencing, let's talk about how we're going to manage it, you know. And one of the really in therapy and in the mental health world, one of a really effective treatment is exposure therapy to deal with fears and anxiety. So we're going to have Jen talk a little bit about exposure therapy so she can tell you guys about the concept, and then we'll talk a little more detail about how to use it.
Okay.
Jen, you want to tell us about exposure therapy?
So essentially, the fundamental reality of our brains is such that repeated exposure to a stressful stimulus results over time in a desensitization. So unlike there's a habituation that happens on a neurological level. And this was done in a single-celled organism, and that's where the studies come from. And so the way that we use that in terms of exposure response therapy is that when you are initially exposed to a scary, stressful, uncomfortable stimulus, there's a sort of peak reaction in terms of anxiety. So, you know, a classic one is like fear of flying. If you're fearful of flying, you get on that plane that first time, your alarm bells are going off, you're having trouble breathing, your palms are sweaty. If you don't travel again for 6 months, you're going to have that same peak reaction. If for some reason you get on an airplane every day or every week for 6 weeks, and every time you get on, you have a peak reaction, and what we know is if you stick with it, it subsides. If you get to the other side of that, every time you're exposed to it, it's a little bit less because you've seen that you can move through it. You've seen that you've survived it. You are able to adjust and adapt. There's more room for it without the acute fear. And so we use that in therapy all the time. When something is uncomfortable, you dip into it and then you dip out to it. Every time you do that, your reactivity to it is slightly less. When you rescue yourself from the peak, which people often do, when you avoid, I'm never doing that again, or you have a drink, or you take a Xanax, you lose the opportunity of that discomfort to see that you actually can get comfortable with the discomfort, rather than you remove yourself from the discomfort, that feels better. And that positively reinforces that must have been dangerous and unsafe. Phew, it's a good thing I didn't do that. And that creates even more anxiety the next time. And so again, it's not that it's comfortable. We don't engage in difficult things because it feels good. We do it because we have to get comfortable with the discomfort. And the only way to do that is to expose ourselves to it over time.
I love that phrase, get comfortable with the discomfort. We say that all the time as clinicians, like part of doing the work is recognizing you got to get comfortable. That's going to be uncomfortable sometimes whenever you're trying something new or delving deep into a topic that might be hard to talk about or deal with. So I'm glad you touched on that. And I think when you were talking about people avoiding, I think there are situations where, people are hitting the ground running and like diving really deep into it, or they're just avoiding it. And I was even thinking, I know I was going to talk about this earlier, but I'm going to bring it up now that, people are at different stages. There are some people that cannot wait to get back out there, are like dying to go experience everything. And then there are other people who are like, oh my God, keep me in my pod. I don't want to deal with the stressors outside. So, Jen and I were talking, like, I'm an extrovert, and I was like so excited to like, oh my God, I can't wait to get out of my house. Like, my family's driving me nuts after 18 months. I just need to break out. I need to see somebody else. I need to look at different scenery. I'm excited to socialize again. And then I have other friends, and Jen even said, like, part of it, people like to be at home. Yeah. So everybody's different, and something that we have to be aware of. So when we're talking about exposure therapy, I think it's really important to recognize that it's important to go slow. And even for myself, I said I'm extrovert, I went in and then I was like exhausted after doing a few outings because it was so much stimulation that we're not used to. So I think it's really important to kind of do this slowly, and maybe look at a bunch of things that you find concerning or fearful and rate them on a scale from 0 to 10. Like, what is something that you want to do but makes you really nervous to do, and put that at a 10. And then something that doesn't seem as threatening, put that as 0, like all the activities that you might want to do. And I can just list a few. We'll talk about pandemic, people going on an airplane, people traveling, people going indoors in a restaurant, eating indoors, riding public transportation, and even for GNE myopathy patients, maybe it is like going to a place that might be challenging physically for them and emotionally. So kind of rating those experiences and kind of recognizing where you're at and what things you want to tackle first. And one thing that I really like patients to think about is their tank. And I talk about their emotional tank, of how you feel on that given day. Are you feeling emotionally and physically full? And if your tank is feeling pretty full, maybe you're at a place where you might want to tackle something that might be a little bit harder. If it's not, maybe that's not a good day to do a thing that's rated at an 8 or plus, 9 or 10. That, like, maybe you're like, I'm not feeling great today. I'm not going to tackle that because I want to set myself up for success. So, kind of being aware of what things are causing some anxiety and tackling those when your emotional tank is filled up as much as it can be. And then you might want to ask yourself, like, is there anything you can do to fill up your tank before you go out and do that kind of anxiety producing activity? Like, could you take a nap before? Could you, whatever you need to do to self-soothe, is there anything that might help you so you can get re-energized and feel a little bit more filled up before you take on something that might be challenging?
Can I add to that?
Yes, please.
Well, I know we're going to talk about this in the next slide, but what you said about essentially honoring where you're at, not pushing yourself too hard, what that is also going to require is in those little moments, making room to sort of mourn the loss that you're not in a place where you're up for doing that, rather than oftentimes trying to stay in denial. It's fine, I can do it, because it's too uncomfortable to recognize your own limitations. And maybe because then you judge yourself or you don't want to confront that reality. But that is why all of this is about, and again, I'll let you segue into the next slide, but self-compassion, making room for feelings. The uncomfortable feelings are not welcome always, but they are healthy and responsible. And they're always what allows us to get to a place of acceptance, which is where more of the comfort is, rather than fighting
Right.
against it.
Right. Right. Exactly. And I think, part of what I like about when you're saying that, when people are able to acknowledge and be open and vulnerable that this is hard, they recognize so many other people are gonna be like, yeah, that is hard. Thank you for saying that. Giving me permission to say this is really tough. And that is going to lead a little bit to what we're going to talk about next. Hold on, I can get to the next. So this is kind of a mindfulness exercise that might be useful for some people when you're getting yourself caught up in this like excessive thoughts or this negative loop in your mind, and you start to worry about all the things that are happening. So, this takes awareness. This takes time to slow down and really kind of be aware of your thoughts. And I'm going to kind of go through these 4 steps and we'll talk a little bit about them. The first thing to do, and I'm going to give an example about a thought about a pandemic just because it's the topic at hand, but you can think about anything that's bringing some anxiety up for you. That you check in with yourself. You notice what's going on with your body. You notice what kind of sensations you're feeling, what thoughts are entering your mind. And there is some belief that if you can notice it, if you can name it, you can tame it. So let's talk a little bit about like what might be some of the thoughts that people are having. Like maybe you notice that you're feeling a little nervous about going out in public again and socializing. You're like, God, I'm really nervous about that. And you notice that you're having thoughts about it. First thing to do is like, you noticed it, then you name it. Like, I noticed that I've been having these thoughts a lot, and you're naming it. And then what you can do is step back and kind of go, okay, why am I having these thoughts? Well, okay, we're in a pandemic. This is the first time that we're going back out in public again. And I'm probably not the only person feeling this way. I bet you other people are also having these thoughts. So kind of like what Jen was saying earlier, like a compassionate voice to yourself to say, hey, what you're experiencing is what a lot of people are probably experiencing. Don't be so critical of yourself that you're having these thoughts. It's completely understandable that you would be. And kind of recognize that this is the first time for a lot of us. I'm a big Brene Brown fan, and she has this whole, I don't know if anyone follows her, but she does this podcast about, first times. And it's all about the anxiety about doing things for the first time and how we tend to be so critical of ourselves, and how we got to recognize that you're kind of going into the arena for the first time, and it is overwhelming. The other thing to do is to neutralize these thoughts, and everybody has to figure out what things that they can do that would help neutralize these thoughts that they're having. And this is where I know some people have like a mantra that they tell themselves to kind of release the thought. Sometimes people do guided imagery, thinking of those thoughts and finding a way for it to kind of gently, not that it's not there, but float away into the sunset or into the sky, whatever imagery works for you. Sometimes people, whatever you do to self-soothe, like if there's so many different things that people can do to kind of let go of some of those thoughts. But I think a lot of this is, having some self-awareness. The other thing, Jen and I were talking about this yesterday, that I absolutely love to do, and I actually do it myself too, because I recognize that we kind of sometimes get into these thoughts of these worrisome thoughts. They can go on throughout the day. And sometimes for me, they happen at night when it's really quiet at my house, and you start thinking about all these thoughts that you have. And they're intrusive. Sometimes you're like, I don't really want to be thinking about this because it's interfering with my sleep. So what I really try to tell patients and clients to do is to kind of, and this takes practice, give yourself 20 minutes a day. And that is your worry time. And you pick a time of the day, like I'm going to do it every morning when I'm in the shower, or every morning at 10 a.m. I'm going to let myself worry for 20 minutes and think about all the things that I'm worried about. And sometimes it's helpful just to even write down all the stuff that you're thinking about that's stressing you out, or type it however you need to do it. And then throughout the day, you might realize when those thoughts come up in your head, you're like, stop. This is not the time to be going there. I'm going to wait till my time. I have a designated time that I'm going to let myself worry. And I'm telling you, it takes some time, but it can really work. And then oftentimes you'll look back at the things that you were worried about like a week ago, and I'll be like, oh my God, that's so not that important right now. Why did I lose sleep over something that, because now I have some new thoughts to worry about that's so irrelevant now. And you recognize that there's a pattern. Jen, can you say a little bit more about that? I know we were laughing about it yesterday of how that works.
Yes, so I'll comment on that and I'll go back to a couple of things you said. So yes, this coping, this tool that we have, which is, so what, one of them is worry time. For some people, it's 3 times a day, 9 a.m., 3 p.m., 9 p.m. And the idea is multifold, right? Part of it is you have so many thoughts and worries swimming around your head, and the anxiety says, hold on to those thoughts because you don't want to forget those thoughts, because in your mind, when you're anxious, the worry is a form of protection. As long as I'm worrying about it, maybe it won't happen. And so the idea is to give your mind a break, take those thoughts out of your head and write them down on paper in black and white. A, you have that perspective, some distancing from. B, you can rest assured that your notebook is holding on to the worries for you. Now, people sometimes resist this because I don't want to think about it. I don't want to write it down. I don't want to put it in the universe. I just want to avoid it. And what we know is when there are uncomfortable feelings or thoughts, by avoiding them and not tending to them, they don't just dissolve. In fact, they get stuck somewhere and they'll find a way of coming out. Often they leak out in agitation, irritability, depression, eating. And so it's an exposure exercise, like exposures before, to write them down and expose yourself to them. And as you said, see, when you get a distance, am I having some distorted perceptions in there? Are those accurate assessments of what's going on? Or is that just my anxiety skewing things towards the negative, as anxiety often does? And all of this slide is essentially what we call mindfulness, which my definition with patients is observing without reacting. So it's always, always, always letting in the feelings, but rather than being reactive to them, like I'm having anxiety. Oh no, now I'm anxious again. And now your baseline discomfort is compounded by a judgment and an anxiety about the fact that you're having anxiety, to just, as you're saying, notice and not judge yourself for them, not be too reactive. And coupling that, often a really helpful tool is, mindfulness is not turning off all the thoughts and going blank. Mindfulness is letting in all the thoughts, letting all the worries, and coupling that with what we call kind of diaphragmatic breathing is one way. So breathing deeply, which physiologically sends a message to your mind that you're safe. You're not in danger. And that allows you to make room for, nothing is too threatening to think and feel. And you just learn how to be with that thought rather than tensing up around that thought. And so deep breathing, it doesn't have to be, belly breathing, just breathing, slowing things down. And self-compassion, which is, again, not judging yourself. And then what you were saying about with COVID, going out and re-socializing and new experiences, I just want to acknowledge, for patients, we are constantly being exposed to new bodies in which we live. So any new experience is stressful because it's uncertain, because you've never been there. And so every time, so this idea of a year and a half not having, let's say, been out and navigated, opening a heavy door to a restaurant, knowing where the bathroom is, wondering that is constantly happening for us. And so it is exhausting and it is doubly overwhelming. And so again, to your point, Carol, of pacing ourselves and allowing room for those feelings, which ultimately is a lot about learning how to grieve. And grief requires some sadness. And I know we don't want to feel sad because it feels like that makes things worse, but actually feeling sad is the path towards feeling more settled and happier, because you let those feelings up and out. You don't try to deny them. Denying feelings never really works in the way we want it to. I have lots of big feelings about this topic.
Yes, and it makes sense, like what you were saying.
Feeling.
Exactly. Well, it's important. It's really important, because denying it makes it actually, as we know, worse. Right. And which is kind of lead us to the next slide. Our minds, we like structure and predictability. We're just people like that. We like to know what's ahead. We like to feel like we have some control over things, especially when things feel so out of our control. And I think when you have this disease, you feel out of control a lot of times. And during the pandemic, I think there is this sense of feeling out of control. So what do we have control over? So I think it is important to look at when you're engaging in activities and things that you're going to do during your day, is find stuff that are going to conquer these things, it's going to be worth your while. So try to find things that you find pleasurable, that give you a sense of accomplishment, that might check off the box of socialization, being with someone that brings you joy, that you enjoy spending time with. It's also probably important to limit the amount of excessive idle time, because I think the more you're alone in your thoughts and not keeping yourself engaged and occupied, you can start to worry and get overloaded. And I think too, with the news, we were talking about the news cycle and how, if you start watching the news all day, you literally can start noticing how it changes your mood. And I notice that a lot too. Like I'll suddenly be so irritated when I was not in a bad mood. And I'm like, what do you mean we're going to have to wear masks again indoors? We've only had it off for 2 weeks, And then you start looking at the news cycle and you start going on this like rabbit hole, and that's not healthy. So one thing to do is kind of recognize, just like I did the worry time, find a time you check the news, if it's once or twice or 3 times a day, but not throughout the whole day where you're getting alerts on your phone, that you spend time just catching yourself up to be informed. And the other thing too is to really let people know, I mean, this is hard, but to communicate with others, loved ones, of what you're needing, and recognizing during this pandemic and even with your disease that you might need things at different times, and that's okay. That, there's no right or wrong way, and everyone's at different levels of discomfort about different things. Even though someone might be more comfortable doing certain things and you're not there yet, it's okay. And to let somebody know, like, I feel comfortable doing this and this is what I'm going to need. And I think we don't do that enough. And sometimes too, people will go talk to other people instead of talking directly with the person, and being able to let, your spouse or your kids or your loved ones know, like, I need this. I feel more comfortable doing this, and this is why, and I need that. So, it's not, even though it sounds so simple, I don't think we do it enough. And then we will get to attentional focusing. Now, as we talked about earlier, our minds tend to have a negativity bias. Like, we look at things, because it's a biological function, as Jen said earlier. Like, it's kind of, we have to assess our environment all the time, and for risk. And I think with GNE myopathy patients, you always have to assess the risk level before you engage in something. And that is part of what you have to do. But then you have to make sure that you also reserve enough time for the positive moments and to really savor that. And when you have those moments, to think about it, to write about it, to maybe have a gratitude list of all the things that you have in your life that you want to hold on to. And, Jen and I were talking about, like, during this pandemic, what really are the things that, like, we want to hold on to? What are the silver linings, things that, like, as much as there was yucky and bad stuff that happened, and, that is a part of it, but what were some of the things we learned from it and that we want to keep in our lives and keep in our routines and keep in ways that maybe we found fulfilling and easier to manage? So Jen, you want to talk a little bit about what we were discussing?
So I just want to comment on silver linings. I think silver linings are crucial to emotional survival, just like gratitude. And I think it's also important for people to know that they are not there to substitute or override what's hard. They are there right alongside what's hard. So there's a lot of pain and a lot of disappointment and loss. And to sort of counterbalance that, not to subtract from, there's a lot of gratitude that we can have. And for me personally, just from again, fascinating that it's so hard for this world to become increasingly more accessible. And yet, if there's a global pandemic, for everybody, there can be curbside pickups, and there can be telemedicine appointments for everybody. And so I think it's really valuable to look at the disservice we do when we can't make things more inclusive or accessible for everybody or for certain populations. So that those have been game changers for me. And I have anxiety about not being able to pull up and pop the trunk and have someone put something in. And for me, very personally, and my sister and I were talking about this last week, really for, I used to swim every Sunday at the gym where I no longer go. And that was very anxiety producing because that's a form of me taking care of myself physically. And I don't have a pool at home, but my sister does, who lives 10 minutes away. And so she started heating up her pool very generously. And basically, since shutdown, we have every Sunday, I go over there to swim, and the kids come most of the time, and her kids. And so it's become this sort of built-in bonding, regular, consistent hanging out time, which would have been a lot harder to orchestrate. And I don't think we did before. So that's really been a gift that I'm hoping to keep up indefinitely.
I love that ritual when you were sharing it with me the other day. And I was thinking of all the other rituals that I want to keep. Like, we never had so many family dinners. And I realized, like, you know, with the hustle and bustle of life, like a lot of times we don't slow down and take time for that. And I want to make sure that we keep doing that. If it's not, I mean, it was every night during the pandemic. Let's just try to find a way to make it maybe 3 out of nights a week. And those are the things I want to hold on to. And I'm glad you brought up the stuff about things that are more accessible for patients and for everybody. Like, why didn't we do this earlier? Like, make it easier, like, for people. And the telemedicine is huge. You know, that's made a big difference for a lot of patients. So we're going to talk also about when does the reentry anxiety, or when does anxiety become a problem? And I think this is when you really have to look at if it's excessive, if it's interfering with your ability to function on a daily level. And it's been a period of time. We're not just talking a few days, but let's say it's been going on for months and months, that it's maybe time to go talk to someone. And, you know, these days it's pretty easy with telemedicine to get an appointment with a therapist, with a professional to kind of help you. And as we know, you know, patients who have GNE myopathy, you're dealing with a pretty chronic disease that has a lot of emotional ramifications related and physical ramifications. And there's something to be said about taking care of your mind. And there is a lot of research, and we talked about this 2 weeks ago with Dr. Sepide Tabibian about the mind-body connection and how important that is in taking care of yourself. So Jen, you want to say a little bit more about this? Because I know we talk about it a lot.
In terms of, so I think if I could impart any message, if it hasn't been clear already, especially for us patients, we really, for the most part, I mean, we can try and we can do what we can, but we really can't control, which is the hardest part about this disease. We can exercise, we can eat healthy, we can try to sleep. At the end, our bodies are slowly deteriorating, and that is a hard pill to swallow. And I think people in general, but especially patients, and I was one of them 15 years ago, avoid really tending to their mental health or minimize or dismiss how beneficial it could be processing feelings around it, because unless it's going to cure the disease, nothing's going to change. You know, so often patients or people will say, it's not going to change my reality. Being in therapy, I know my issues. It's not going to alter the outcome. So a little bit of like, what's the point? And the point here is, the reality is we don't have a cure or treatment yet. So this is about your internal emotional quality of life between now and then. And by the way, life will still be hard in other ways. It always is. But also about, that is one of the few things we can control. How do we tolerate the discomfort that comes up? How do we cope with the disappointment and the fear? Who can we tell when you don't feel comfortable telling a partner or a friend because you feel guilty or you feel bad, or you don't want to impose, you don't want to upset them? The therapeutic value and benefit of having, and it has to be a good fit, it takes time to find a good therapist, having a space where it feels so safe, where you don't feel judged, where you're not worried about upsetting that person. Again, back to exposure, it's a place to expose yourself to all those intimate, scary, deep, intimate whispers that you hear, that it can feel very lonely to keep those to yourselves. If you're lucky, like I'm very lucky to have a spouse who can hear it all and it feels safe and we can share that space together. But I get that that's not easy to find. And so it's not, again, not comfortable to go and do therapy and shine a light on all of the discomforts. It's also not comfortable to keep that all to yourself? And which of those discomforts, again, is in the service of longer term comfort? Having that release, having a session where maybe all you do is cry, you will find that you will have your best night's sleep when you have taken so much of that up and out. And I think people don't realize that until they've experienced it. That's my pitch.
Yes, that's my pitch too. And I mean, from being a clinician, that's what a lot of people say. God, I was so skeptical of therapy and I didn't realize how much it was going to help me. So thank you for addressing that as well. I know we're getting close to an hour and I want to make sure we have time for the Q&A. So I'm going to go quickly through the takeaways and then we're going to get to the Q&A. And I'm sorry, this went a little longer, but we'll try to wrap it up. So the key takeaways: the pandemic's impact on one's mental and physical well-being. We talked a lot about that. We look at gradually going back into activities when your tank is full and use some of the tools, hopefully we talked about today, to track how you feel. And maybe you can implement some of the strategies too to help you cope. And lastly, seek out support and help when you feel your anxiety or anything, even managing this disease is interfering with your ability to take care of yourself. It's understandable. So without further ado, let's get to the Q&A.
Okay, you guys, that was, sorry, that was really, really great. So thank you so much. I've been nodding my head yes in agreement like throughout your entire presentation. So I know there were important takeaways there for each and every person watching, and also for those who eventually watch this on our virtual library, such important information for people to have access to. So thank you. And I will say that, so we have a comment that kind of leads to a question. Someone said, I appreciate your comments about allowing ourselves to grieve about the loss of our body functionality. That's a great reminder to help us acknowledge and move forward. I tend to find myself getting anxious days before I'm planning to go out. And mostly if I'm going to a place I've never been, not knowing the accessibility challenges I might face tends to be what makes me most anxious. And that kind of leads to another question we have, which is, can you talk about how to manage a panic attack when you are out in public? If that happens once you've reached that place and you've dealt with the anxiety before you get there, what can you do in the moment that you feel it coming on? So sort of two things, but wrapped up in the same thing.
So I would say naturally there's going to be anticipatory anxiety. Again, it's an unknown. You don't have control over how it's going to go. So first, acknowledging those feelings. And I don't know, in that specifically for patients, for us, how much can you control? How much can you call in advance? How much can you ask for a table in a certain location? Again, that requires you having to confront and acknowledge that we have this disease, that we do have to take these extra steps. There's a tendency maybe to want to, it's fine, it'll be fine, just to not have to dip into that discomfort. So those are practical tools. When, what is panic? It is physiologically your body is revving up for fight, flight, or freeze. And so people get very panicked about the panic because the fear is usually one of a few things. I'm going to lose my mind. I'm going to lose control. I'm going to have a heart attack and die. That's not how it works. That's how it feels. But feelings are not facts. And when you feel something so strongly, it starts to become a truth. And then there starts to be a reactivity to what your mind is telling you is true. So one of the first things is always, just like we've been saying all along, notice my heart is racing, I'm feeling shortness of breath. This is uncomfortable, not I'm going to die, because no one's ever, thank God, died or have a heart attack from a panic attack. But noticing it's uncomfortable and reminding yourself, I can do uncomfortable things. I can feel hard feelings. If that's not enough, which often it isn't, because when you're so revved up, you lose control of your rational, logical thought process. Then it becomes about how do you re-regulate your body so that it's not sending the message to your brain, there is a genuine threat. And again, breathing has tremendous benefit. And specifically what we call diaphragmatic breathing, abdominal breathing, belly breathing. Part of the value of that is it distracts you from the anxiety and you focus on your breath. And distraction is a healthy coping tool when it's a safe distraction. And part of it is breathing in through your nose, trying to watch your belly expand, breathing out, belly contracting. You don't have to be perfect at it, but in a way that physiologically actually alters the pH of your blood and slows things down. And then you can kind of reassess and reevaluate. So breathing is really big, along with distraction. like Carol was saying, naming things and meaning like, first of all, feeling your body, feeling your feet on the ground, seeing what's around you. If you are somewhere and you can go outside and just look at the big wide open world and see the sky, get some perspective, have a glass of water. All of those are just ways to kind of minimize the distorted perception you're having of your reality in that moment.
Great. Carol, did you want to add anything?
No, I think that was really useful. I think too, when she was talking about looking at other things, you're like trying to change your sensory experience. So if you can name or smell something or see something or touch something, that will kind of shift your body out of the panic mode. It doesn't always work, but it can be very useful. And that's the thing. You try these tools, whether it's the breathing, whether it's naming things in your environment, and see what works for you.
Right. Okay. One more question, I know we're short on time, so I'm going to ask this one. During the shutdown, patients are hesitant to reach out to mental health professionals as many patients have issues getting privacy in their living situation. I know you addressed the importance of reaching out, but what are your thoughts specifically about that?
So privacy, because they don't have a private place in their house to have the session?
Right. You're someone who's living with caregiving and dependent on caregiving. It seems like there's a hesitancy among patients to seek out any kind of help when they can't go somewhere to do that.
Right. I know that's come up. I've heard several patients wanting to have sessions, but not figuring out how to get to a place where they could have some privacy. Jen, what are your thoughts on that?
I mean, it's a good, so you're saying for people who aren't very mobile, they can't get up and go in their car and do a session where I have patients. And I don't know if it's a discomfort in asking the caregiver to step out or take a break, if it's discomfort with explaining, I guess it sounds like why they need the private space, because there's still a bit of a stigma. I mean, it's a tough one, but again, this becomes about feeling worthy of or getting comfortable with the discomfort of having certain needs, because we are all needy. And it's, again, from a survival standpoint, it's not comfortable to feel needy. It puts you at risk. But this is not about, this is about emotional survival. So, and I don't know, I mean, it's an interesting question. I think it also depends on the dynamic with the caregiver, how honest you can be, but maybe it feels more comfortable to say, I'm going to try a meditation app. Is that answering the question? Like, there's massaging the truth, if that's what it takes. I don't know. It's a tough one. Again, it's another layer of discomfort that we have to face. Right. We can't just say, I'm going to go in the other room. Right. If you can't physically, I mean, the level of the loss of not even having this sort of sanctity of privacy when you want it, to lose what is exactly what has become a luxury when it used to, for so many of us, be automatic. The lack of independence, right. Self-reliance on others, right. More of the reason to have to find that private space to process all of that.
Right. I think
you really, I think this comes up a lot. I mean, a lot of patients have shared with me that they've actually wanted to even have a session with me, but they're trying to figure out how can they get they want to talk about their family situation. And maybe they do need to talk and vent about their caregiver, but they know they can't have that conversation because the person's always at home. So, there's different things. I thought, like, maybe talking to your caregiver, a friend of your caregiver, your partner, say, hey, can you make sure you take this person out at this time of day so I can schedule a session? Maybe, because it is hard to say, hey, to be honest, and saying, I really need to talk to someone, I need some privacy. It's hard to say that to someone, but maybe that's the first step of being able to advocate for your needs. And it's not easy. And to say, I just feel like I need to talk to someone to process some things and I need some privacy. Is that okay with you? And would you mind giving me, and maybe the reason they don't want to give your privacy is they're worried that you might need them if you fall or you need something. And you can say, listen, I'll have my phone nearby. If I need something, I promise I'll let you know, but I'm going to stay in this one place for an hour and I need some private time.
Yeah.
It's hard though. I know it's not easy, but as you said, Jen, get comfortable with having these uncomfortable conversations, because you have to be able to advocate for what you need. And it's not easy.
Right. And the last thing you want is
I don't know if we
anxiety
answered
about-
enough.
Yeah, I was just going to say the last thing you want is anxiety about your anxiety, right?
Right.
And I'll just add, when you
And
do
so-
that the first time, if by the way, again, your caregiver may be very respectful, understanding, may want to break. There's a lot of mind reading that goes on with anxiety. They're going to think this, they're going to feel hurt, or
Right.
they're going to be fine with it, or they'll be worried about it. And that's okay, because they have to then manage that. But when you do that the first time and then you get a need met, and let's say you have a session, again, that positively reinforces, and you've already done it once before and you see the benefit, it makes it so much easier the next time and the next time. And then over time, hopefully it becomes a non-issue. But you
Right.
can't know
Yeah.
that until you take that risk. And it is a risk, but growth doesn't happen without discomfort. It just doesn't. So you can stay stuck in the same place, or you can venture out of the comfort zone and see, and you might be surprised at the outcome.
Right.
Exactly.
Amazing.
Like
Really-
those baby steps.
Right.
Yeah, really good advice. And then as far as plugs go, I will say that as part of our GNEM multidisciplinary clinic, we do offer an emotional wellness clinic. So any GNEM patients and caregivers who want to seek some help and some guidance, not necessarily a therapeutic session, but guidance in ways to reach that, can reach out to us through Carol. Carol, I don't know if you want to just mention, a better description of what it is you're doing with people, and then we'll let people.
Yeah. Sure. Part of the emotional wellness clinic is I can do needs assessments with people who would check in about where they're at. And we can talk a little bit. And sometimes one session's enough for patients, that they recognize, okay, this was helpful. These are some tools I can use. Kind of some of the things we talked about today. Sometimes people just need a few kind of guidelines, or they might need some help kind of figuring out that maybe therapy would be useful. And then I give them some tips about how to find a therapist that might be a good fit. I mean, there's a range of things, but I would do a session, help you problem solve. Like, what is it that you're looking for? How can I help? Let's kind of work this through together. So you can find my information on the website, and I should know my email by heart, but I'm going to tell it to you guys right now. My one through, C. Gelbard, LCSW at cureGNEM.org.
Yeah. And you can always reach any of us at
Reach out to me.
info. Yeah.
And I just want to just plug my blog, but if people, it's hard sometimes, even just reading and having a patient's experience, and there are a bunch of us out here who blog, but to normalize and validate what it's like for you can be therapeutic, even without having to talk to anybody live. That's livingwithhibm.com.
Also on our website. And I mean, as a non-patient, but as someone who is fortunate enough to have experience with patients, I have found your blogs to be always so insightful and interesting and honest. And, they always give me pause for thought. I always spend some time after I read them really thinking. So I know personally, I can attest that everyone should be reading those. Any final thoughts before I thank everyone for joining us today? We're good? All right. I do want to thank everyone first, I want to thank Jen and Carol for, I know the amount of time and energy that they put into presentations like this to make them meaningful and applicable to everyone. I think that we can all agree this was really something special, and hopefully you all found it as helpful as I did. So thank you all for joining us today. As I mentioned, this recording, along with all of our speaker series events, live on our virtual learning library, which you can access through our recently redesigned website, cureGNEM.org. We hope to see you here for the rest of our upcoming speaker series events. Thank you.